One of the diagnostic feely things about narcissism is the person takes up the room, right? They take up all the space in the room, and they're not even aware that they're doing it.
So grandiosity and narcissism are really indicators of an individual who is not co-regulating with another.
As clinicians, it's easy to miss more subtle narcissism. People who are both empathetic and well-meaning, but just so concerned with how other people perceive them that they become almost obsessively self-centered and anxious.
What therapists are afraid of, generally, when working with a grandiose or narcissistic client, is the same thing that their partners are afraid of, which is that if you confront them too heavily, if you lean on them, they'll either blow up, they'll leave, or they'll fall apart, and it will be your fault.
Shame is one of the most painful emotions that humans can experience. And so it's not surprising that people want to get away from shame. And some people learn to do that through grandiosity. There's the pain of always being hypervigilant. There's the pain and the pressure of always having to be on top. Always having to be the best. So in therapy, one of the things that I've tried to do is to bring this pain connected to the grandiosity into the office.
So I talk a lot about rigidity and disconnection, and I want to put the narcissism or the grandiosity into the language of your rigid way of looking at this and your rigid way of reacting to this is going to really impact your relationship.
The experience of working with narcissistic patients, I think, has as much to say about the therapist's capacity as it does in terms of changing the experience of the patient.
And I find with narcissists, I really need to cultivate attention and compassion to where their vulnerability is, and so taking a moment to do that.
And they're talking about themselves, and they're not even aware that they're doing it, right? And whatever anybody else says, it comes back to them, and they're not even aware that they're doing it.